16 million Americans suffer from COPD, a chronic lung disease that makes breathing difficult.
Yeah, and for those with severe COPD, there's a procedure that could drastically improve your quality of life. So Marshall Health's Dr. Yosef Swayhat is here to tell us about Zephyr valve treatment. Thank you so much, first off, for being here.
Thank you for having me.
Tell us about this treatment, and I know that this is something you see a lot of.
Yeah, well, actually, COPD is very common, especially in our area, especially because of the high smoking rate in our population. So this is a new, treatment that was approved by the FDA in 2019. So it's minimally invasive. So basically, we do it basically with the bronchoscope. So there's no actual surgery. It helps improve the quality of life of our patients that have very severe or severe emphysema that are not really controlled on the regular medications that we have patients with COPD on.
And we're looking at some images here. What is this showing?
Yeah, this is actually showing the bronchoscope going in the lung, and this is how we actually deploy the valves inside the lung. It's a very simple procedure. Once you are inside, you just push the valve inside the lung, and this valve, what it will do is that it will help divert the air instead of going into the area of emphysema where we do not use the air going in, and it will help shrink actually the lung that has most of the emphysema and divert the air into the other parts of the lung. As you can see there, the area of emphysema is shrinking, and it allows air to go to the healthier part of the lung where basically oxygen can go to the healthy lung, and it can transport the oxygen into the bloodstream.
Oh, wow.
It's amazing how adaptable our bodies are, and you know.
Yes, and the healthy lung basically takes over that the entire space where the emphysema was, and actually patients almost immediately feel the benefit from the valves. Yeah, actually, when they wake up from anesthesia, because we do this under complete anesthesia, and they can feel the difference if they are, of course, good candidates for it.
Yes. Well, talk about who would be a good candidate and maybe who would not be for this.
Yeah, so basically it's, this procedure is limited to patients who have severe form of the emphysema. COPD has, it's a big term, it's a big umbrella. There's like chronic bronchitis, there's emphysema. All of these are diseases that are under COPD, but this procedure is basically designed to help people who have predominantly emphysema as part of their COPD.
Once they have this procedure, do they no longer need any assistance, like, you know, oxygen, things like that?
So a lot of patients will feel much better when we put in the valves, that their quality of life improves a lot. Some people do get off of their oxygen, but they're able to do much more in their lives, and that's the main benefit of the procedure. Get around the house, get around, do their grocery shopping, I mean, get around, play with grandkids, for example.
Yeah, and that's what's important.
Exactly, that family time, that quality of life. And I'm sure a benefit is that, you know, you don't have to do any cuts. This is not a full-on surgery.
Yes, previously, I mean, we used to do lung volume reduction surgery, which was very, very complicated, but this procedure basically replaces that.
It's amazing.
That is wonderful. And I bet it's rewarding for you when you see patients who are leading a more active life again.
Absolutely. I mean, it's very, very rewarding.
Now, if somebody wants to learn more, if they want to learn how to sign up or get evaluated, should they go through their primary care provider or just call you? What do you recommend?
That's basically the first step, because is to go through their primary care provider. But of course, we're available in the Lung Health Center. There are multiple pulmonologists that can assess them, nurse practitioners, and myself, of course, to see if they are good candidates for this procedure.
That is wonderful.
And we have the contact information up on the page right now, and this will be online if you need to refer back. So thank you so much for explaining it, and that the visual really helps to provide the information.
Thank you for having me.
Yes, thank you so much.